millions of Americans will be losing their Medicaid, their health insurance over the next year or so. This is Ed Weir, retired district manager of the Social Security Administration. We help people throughout the country with all things Social Security, Medicare, Medicaid, the Affordable Care Act, survivor benefits, disability benefits. So if you have any other questions about any or all of the above, make sure you reach out to us, watch our videos, subscribe, know all that good stuff. All right, so what happened is during COVID, the federal government told the states, you will no longer do a redetermination. So if you're receiving CHIP or Medicaid or Medi-Cal or whatever state program you were receiving, usually what happens is about once a year, they review everything. They call you in or call you up and say, okay, you're receiving help from the state on your health insurance. We just want to make sure, you didn't hit the lottery, last week and, now you won the $2 billion lottery. If you did, then number one, call me up and say hi. But then you will be kicked off because, Medicaid, CHIP and all that are welfare programs. And if you got a whole bunch of money now, you're not entitled to that. But because of COVID, the federal government told the states, no more redeterminations. Don't do those. That has now changed. So the federal government has said, okay, you can start doing this. So starting April 1st, some states have already begun. They're going to start doing the redeterminations, and they're going to start essentially kicking people off of their health insurance that they've perhaps had for several years because of income, resources, and all the rest of it. So it's important that you make sure you're in the right position for when that happens. One of the big things is you have to make sure CMS, the Center for Medicare and Medicaid Services, and states throughout the country are sending reminders and doing, public service announcement. I guess I'm doing a public service announcement myself right now to make sure whatever state agency you have your health insurance through, make sure they have your correct address and phone number and all that, because they are going to be sending you a redetermination, a recertification package, or contacting you to recertify. And be careful of scams. Anytime I worked for Social Security Administration, I worked with the Office of the Inspector General, federal law enforcement, and we know that anytime stimulus checks and anything like this, they're starting to talk about it, then there are shady organizations that take advantage of it and call you up, and they might say, I'm calling from the Nebraska Department of Welfare if you live in Nebraska, and I just want to update our records on your Medicaid to make sure you're still certified. Give me your name, date of birth, and Social Security number to confirm. So be very, very careful. So number one, be very, very careful. It's interesting. I worked for the Social Security Administration for 20 years, and I could be in my office at the Social Security Administration in the Social Security building as a federal employee, and I would get calls on my cell phone from someone and say, hey, we're going to arrest you because, you didn't do this, that, and the other, and we're going to, cancel your Social Security number and all this kind of stuff unless you, go down to Walmart and give us money and stuff. And I'm like, oh, okay, you're from Social Security, and what office do you work in? And, what's your, so what's your name? And I look them up in the internal records, and it's like, there was nobody by that name in that particular office. And they're like, how do you know? Because I am a district manager, and they immediately hang up. And so even I got scam calls working at Social Security Administration. So be careful. Long story short, be careful. All right. So make sure your address is updated. Your phone number is updated with the state agency, because if you don't get that recertification and you don't return it, it's important you return it. If you don't return it, then your health insurance is going to go bye-bye. They're going to cancel your health insurance. So you have to make sure your address and everything is correct. And then once you get that recertification package or that phone number, you schedule an appointment with the particular agency, and it's that particular agency. If you don't recertify, then yes, they will probably cancel you. So be very, very careful and make sure everything is correct there. All right. So if they do, what are your options? What kind of options do you have if you know for sure that, okay, yeah, I went back to work, or, I got this inheritance, or, I won the $2 billion lottery, whatever the case may be. What are your options? The Affordable Care Act, Obamacare. There are subsidies there. There are cost savings there. Maybe we can find a plan, get with someone you trust about healthcare, health insurance that can enroll you, and find a plan. If you like, we'd be more than happy to help you out. We help people throughout the country, again, with all things Social Security, Medicare, and the Affordable Care Act. So we can look for a plan in your particular area. And because we are also experts on all the other programs, inside experience, tips, tricks, and secrets pretty much nobody else knows. Based on our decades of experience, if you choose to let us help you with the Affordable Care Act, we can also, eventually help you with the retirement plan for retirement, survivor benefits. If you want to file for disability, we can walk you through that entire process. When you turn 65, or if you receive Medicare based on disability, we can walk you through the entire Medicare process and also help you find a Medicare plan. Again, no obligation. If you've got any questions, make sure you reach out to us, and we can help you out. If you want us to help you with any or all of the other stuff, the Affordable Care Act and Medicare Part A, B, C, D, then we'd be more than happy to help you out. But no obligation. There's no, we're kind of paying it forward. So helping as many people as possible. And if they choose to let us help them, then that's a beautiful thing. You don't want to be without health insurance. Inevitably, what happens is you have health insurance for a year or 2 years, and you don't really use it, and then it lapses, and then guess what happens the month after? That's unfortunate. It seems to be the nature of the universe that happens. So let's make sure that one insurance stops if it, in fact, your state Medicaid or health insurance stops from the state. Let's make sure the Affordable Care Act, the federal Obamacare, starts the following month. And again, we can help you with that. But that is it. Reach out to us if you have any questions. Make sure you check out some of our other videos. I'm uploading videos on a regular basis, and subscribe and like and do all that YouTube type stuff. And that way this goes out to more people, and we can help more people out there. That's kind of what I'm doing in my retirement. So it's a beautiful day, and hopefully everything goes well. And if it does, then I guess we'll see you when you turn 62 or so and you're really looking to file for retirement. So hopefully your Medicaid is approved and everything goes by perfectly, and we'll see you in your 60s. All right. Take care. Have a beautiful day.